I am Maurice Graham, founder, executive director of AFAA Africa. I have been telling my story and facilitating others telling theirs for the last 15 years. I believe communication is the key. I am a self-starter, motivated by my own life experiences and the power of positive thinking. Personal and social concerns have propelled me into advocacy for a cause I am most passionate and compassionate about: the health and well-being of people of color. Living with HIV since 1983 and recovering from substance abuse since 1996, a career as a telecommunications consultant and systems engineer was interrupted by these two life challenges. After much soul-searching and introspective work, my path was redirected into teaching others how to extend life through education and medical intervention. I believe the truth is setting me free. AFAA Africa is committed to ending the spread of AIDS through the prevention and education programs that AFAA Africa incorporates, thereby transforming the lives of those affected and infected with this devastating disease. Our emphasis is on wellness, physical and mental health of the individual and the community we live in. This requires teamwork with outside collaborators to promote healthy living strategies for our peers. We target high-risk populations in the Bay Area within the African American community and maintain a dynamic relationship with similar organizations in sub-Saharan Africa. We develop our own presentations, educational programs, and promote healthy living strategies for the populations we serve. Our goal and our motto is giving voice to the voiceless, giving hope to the hopeless, transforming the perception of HIV/AIDS in the San Francisco Bay Area and beyond into healthier life practices. According to the 2006 AIDS epidemiologic report produced by the Alameda County Public Health Department, the statistics of HIV infection in the East Bay reflect the national picture. Of the 7,064 total cases diagnosed among Alameda County residents from 1980 to 2006, the majority were either African American, 44%, or European American, 42%, male, 86%, adult ages 30 to 49 years, 71%, men who have sex with men, 61%, or were residents of Oakland, 58% at the time of diagnosis. While the Alameda County AIDS case rate has been declining since 1992, historically it has been higher than both California and the national case rates. The African American community remains the most affected, representing almost 50% of the East Bay AIDS cases. Alameda County declared a state of emergency in 1999 due to the pandemic effect on the African American community. We empower ourselves, one another, when we realize we can make a difference. AFAA Africa is anxious to expand and develop its 4 current programs. One program, the HIV/AIDS Advocacy Council, or HAC, was almost operational but lost its funding in the 11th hour. The HAC is an informational clearinghouse to improve the dissemination of the latest HIV prevention and treatment information to organizations and individuals. The other 4 programs are funded and operational, but new support is needed to proactively deal with upcoming economic conditions. They are the Positively Speaking Speakers Bureau, Peer Navigation, and the Community Forums and Updates, along with our humanitarian missions. Positively Speaking is a program paid by the school districts to talk to high-risk school children on HIV and abuse prevention and treatment. The Peer Navigation Program is intended to improve the lives of those who are infected with peer interaction that is, individuals from the same socioeconomic background. These individuals typically are reluctant to accept care or to be tested. This program is being developed through the Bay Area Network for Positive Health. Our community forums are intended to give the latest HIV information to empower peers to live healthier lives through our relationships with health service organizations, recovery, pharmaceutical, and faith-based organizations. The humanitarian missions, every year since 1998, AFAA Africa has gone to Ghana and other African nations to consult with African health organizations and HIV support groups in the development of programs for treatment of HIV and addiction, ship educational materials, and medical supplies. AFAA Africa has also provided community forums on the latest prevention and treatment issues. Typically, these missions are from 1 to 3 weeks in length. Going public with my HIV positive status has enhanced my credibility with high-risk groups. I also have a long history of recovery from substance abuse using 12-step programs. Addiction has been part of the experience of many of our speakers and people in general living with HIV. We have brought their proven techniques into the design of AFAA Africa treatment and prevention programs. AFAA Africa has established fellowships of recovery where individuals form an emotional and spiritual bond with each other here and in Africa. AFAA Africa wants to create more jobs for people who are infected or affected by HIV and substance use. We are building self-esteem and self-worth with prevention and treatment messages to maintain wellness. Using a peer-to-peer approach that has already been proven to work in our community for 16 years is Positively Speaking and our community forums. By using a harm reduction approach, AFAA Africa tries to diminish social disabilities that damage a person's physical, mental, and spiritual health. Life-affirming behavior is encouraged by peers demonstrating that alternative ways of living are possible. This is a win-win opportunity for both the individual and the community. AFAA Africa has many accomplishments to this date. Since 2007, Positively Speaking has presented to more than 6,500 school children. AFAA Africa has also presented more than 40 HIV local community presentations to adults at health service organizations and treatment for addiction programs. We have used radio and TV to reach thousands of people here and in Africa with a message of hope and practical ways of improving our lives. AFAA Africa has won many community service awards since our inception in 2002. AFAA Africa has also presented at 2 U.S. conferences on AIDS and 2 international AIDS conferences, and works as a consultant with the East Bay AIDS Walk, Bay Area Network for Positive Health, and AIDS Project of the East Bay. We are helping to change lives by example. A complete list of our activities since 2007 is in the appendix of our business plan. Our 5-year business plan is on our website for your review at www.aidsaFrica.org. www.aidforaidsafrica.org. Thank you.